question I get quite frequently in my practice is, what made you go into facial plastic surgery? How did you even get into becoming a doctor? It's interesting because about 2 months ago, I was going through a bunch of old boxes and had my 6th grade paperwork. And one of the names of the essays was, what do I want to be? And it's funny, as I mentioned at that point, I want to be a doctor. So, especially with my sister, my mom saying, I want to have my son as a doctor and this and that, and me always liking the whole thoughts of being a doctor and taking care of patients, that continued. Matter of fact, so from elementary school, then to high school, I kept wanting to be a doctor. I started liking it and thinking about, what could I do to start getting into this? And when I ended up going to college, I started doing volunteer work at the local emergency room at California Hospital. I ran into a good friend of mine whose father worked at this place called the House Ear Institute. And when I met the, Dr. Howard House, who's the founder of the House Ear Institute, and he's founder of a field called otology, which is study of the ears in regards to surgery and hearing and everything else like that. I started working over there and volunteering and watching him perform surgery. And I was a second year in college, a sophomore in college at that time. So I went to USC, undergraduate school. As a matter of fact, I went to Loyola High School, which is a local parochial school here. Right before ending college, I applied to medical school. And I knew I wanted to go in medicine. I ended up doing more volunteer work. I ended up doing some research on ear surgery. It was something that I was very, very excited about. I ended up attending USC School of Medicine. And I had a wonderful time, met great people, and boy, you study pretty hard. I would remember Monday through Friday, I probably would get to bed about 11 p.m. because I'd be studying all day after school. And on Sundays all day I would study. And you have to, when you're going to medical school, you have to always study and you have to really make sure that you do very well. It's very, very competitive and it's very, very hard. I wasn't really sure of what exactly I wanted to get into for my practice of medicine. I did know that I did the research on the ear and saw ear surgery, and I loved it. So after doing my rotations through medical school, surgery and orthopedic surgery and medicine and OBGYN, and I also did a rotation in ear, nose, and throat, I knew for sure that I wanted to be an ear, nose, and throat doctor. So I applied for my residencies. I was excited about it. I ended up going to the University of New Mexico. And the reason why I picked that is because they had 1 resident a year with 5 attendings, which mean that resident is going to be doing a lot of surgery. And what's really important is to do a lot of procedures and see a lot of patients during your residency. Especially in New Mexico, they had a VA, they had a great university, and they had private institutions. I saw all kinds of stuff. And I was doing complex surgeries as a first year. So after I was performing ear, nose, and throat, and by the way, about a good 25 to 30% of otolaryngology is facial plastic and reconstructive surgery, because we're dealing with all the facial anatomy and the nerves. We're doing rhinoplasty, we're doing sinus surgery, we're doing facelifts. This is something that's part of my training, and I already liked this part more than anything. I loved ear surgery, especially what we call skull-based surgery, where we're removing small tumors and masses near the inner ear, which is close to the brain. I enjoyed that, and I also enjoyed facial plastic surgery. Then I did a rotation solely in facial plastic surgery, and I went to go visit a doctor in Rochester, New York, and I loved it. At that point, I said, I really like this facial plastic surgery. And what really confirmed it was some of the reconstruction. As a matter of fact, this cute young boy came in to the hospital one day, and unfortunately, he had a bad situation where 2 Rottweilers attacked him. And he had a lot of lacerations in his face, and especially his scalp. And I ended up performing about 6 surgeries on that boy to make him, get him back to where he was, even though he's still gonna have some scars. But I have to tell you something, that boy always had a smile on his face. He always would wave, he would always give me a hug, and it just was great. And actually taking a child that had these injuries and helping him put back to what he looked like before as best as possible was very rewarding. The most complex aspect of facial plastic surgery is rhinoplasty. And I really like that because it's really, really hard, and it's really hard to get that perfect. You have to just keep trying and trying and trying. As a matter of fact, I remember hearing my mentor, Dr. Regan Thomas, tell me you have to do at least 1,000 rhinoplasties before you get somewhat good at it. Therefore, after I finished my residency, I ended up doing a fellowship with Dr. Regan Thomas in St. Louis, Missouri. And we did all the facial procedures, a lot of what we call nose procedures, where a skin cancer has been removed from the face and then I have to reconstruct it. We ended up doing a lot of scar revisions, complex scar revisions to help camouflage things. For example, a big scar down the cheek, my goal would be to camouflage it and make it minimally visible. Did a lot of rhinoplasty, which I enjoyed the most. And then of course we did aging face surgery, brow lifts and upper eye work and lower eye work and facelifts and hair transplants, and it was great, it was fantastic. When I ended up coming to California, I met my partner, Dr. David Amron, who's a cosmetic dermatologist. We hit it off. As a matter of fact, my mom, my sister, her children, most of my family were patients of Dr. Amron, and that's how I met him. We ended up opening an office in Beverly Hills in 1999, and it was opening a big office, a little bit scary, especially for two young guys that are coming out and starting out fresh. And thank God we're still here doing well. The interesting aspect of my career, I started doing all facial plastics and I loved it. But I started getting in, a niche for doing rhinoplasty, especially ethnic and especially revision rhinoplasty. And that's where about 85% of my practice is focused on, is rhinoplasty. About 60 to 65% of my rhinoplasty patients are revision patients. In other words, someone who's had a previous rhinoplasty. And my goal is to go in there and try to make sure that it looks better and improve the breathing. When you perform a rhinoplasty, it's just very, very difficult, as I mentioned earlier, to get it perfect. No matter how good of a job you do, due to the three-dimensional healing and the shrink wrappage of the skin, you just can't get it perfect. Your nose may look great for the first 6 months, but who knows what it's going to look like after 3 years. And that's why I was working and focusing on performing a aesthetic outcome, but at the same point, how could I prevent this collapse from happening years from now? And that's why there's a lot of swelling and it takes a little longer to heal. But I'd rather have that happen rather than have you collapse later on. In other words, you have to give it a little bit more healing in the initial aspect of the surgery, but in the long run, my goal is to hopefully not to have you have another procedure. Obviously, I'm not perfect, but I try to keep those numbers down quite a bit. So I ended up being the rhinoplasty specialist. I still love doing face work. I have some great techniques for brow lifts and facelifts and eyes that, again, we want to keep natural looking. Especially with a nose job, we want to keep natural. We don't want to look like you've had a unnatural rhinoplasty surgery. And so this is where I am. It's 2010, and everything is going along very well. And it's funny, I look back, and I say to myself, okay, where was I 30 years ago? What I expect to be where I'm at now. And I'm very happy with the way things are going. I wish my mom was here to see this. I lost my mom in 2002, just a few months after I got married. And it's still something I think about my mom every day. And if it really wasn't for her, I don't think I would be doing this. So thanks, Mom.